coccidioidomycosis, which is valley fever. This is by Teresa Oliver, Biology 103, Mrs. Williams. Introduction is coccidioidomycosis is airborne. It's also called valley fever, which is a fungal infection. They're both the same, but one is airborne and one is a fungal infection. The research is talking about how valley fever is airborne. This disease is fungal, and it can take up to years to come into contact with the infection. Some other names for the infection is Joaquin fever and desert fever. It says 1 out of 1,000 will catch this disease, men and women, ages 25 to 55. When valley fever becomes inhaled, they can get stuck in your lungs and cause inflammation. This disease cannot be transported from person to person. Some signs would be fever, chest pain, night sweats, fatigue, joint ache. Symptoms would be you're running low-grade fever, cough, and chest pain. Some symptoms disappear without treatment in at least a month. This disease can spread to the liver, bones, skin, brain, and other organs around the heart. Some of the symptoms are joint pain, loss of appetite, weight loss, night sweats. And difficulty breathing is one of the key elements of symptoms. Then you have some that may show the red blisters or erupt like pimples. If you are not ill with the fever, later in life you may only find out you were infected by a skin or a blood test. The cause is they grow as moles, have long filaments, and they become airborne. They have a complex life cycle where it grows. There is no vaccination to keep people from getting the infection. But like everything else, there is always ways to prevent it. Suspending work during heavy winds, keeping windows and vents closed on vehicles, the use of revegetation water used to reduce airborne dust. Make sure all employees are aware and know what to do if they have any of the symptoms described. Diagnosis is organisms in the tissue, blood. It is hard to diagnose valley fever based off of these signs and symptoms. The provider will have to do a sputum or a culture of patient saliva to determine the illness. People with HIV, AIDS, or Filipinos, Hispanics, Africans, or Native Americans are at risk. Complications is severe pneumonia, ruptured lung nodules, and disseminated disease. Treatment options, they tell you to get plenty of rest, just like with any other infection that you would get, and they would prescribe you antifungal medication. The treatment is to be monitored by a doctor and also to be prescribed medications either orally or intravenously. Valley fever can clear up, but patients can easily have a relapse. So make sure all doses of antifungal medications are finished. Prognosis is, it could go either way. It could be deadly or you could completely get well from it, and then years down the line, with an x-ray or something, it could, you could have a relapse. And these are the references I use for my paper. And thank you for listening to my presentation.